Hi and Assalamualaikum to all of my friends and my beloved lecturer Puan Nur Hafizawati binti Bakar. My name is Alia binti Ahmad and my matrix number is 03DPR20F1034. Today I'm going to present about depression. Next. Okay, table of content that I'll present is definition, sign and symptom of depression, depression causes, treatment for depression, and conclusion. Next. What is depression? Everyone occasionally feels blue or sad, but these feelings are usually short-lived and pass within a couple of days. When you have a depression, it interferes with daily life and causes pain for both you and those who care about you. Depression is a serious illness. Next. Now, I'll tell you the definition of depression. Depression is a common mental disorder that presents with depressed mood, loss of interest or pleasure, feeling of guilt or low self-worth, and disturbed sleep or appetite, low energy, and poor concentration. Next. Okay, this is a prevalence of depression. Depression occurs in persons of all genders, age, and background. Depression is common, affecting about 122 million people worldwide. Depression is among the leading causes of disability worldwide. Depression can be reliably diagnosed and treated in primary care. And the last one, fewer than 25% of those affected have accessed treatments. Next. Okay, now I'm going to share to all of you signs and symptoms of depression. Persistent, sad, anxious, or empty feeling. The second one is feeling of hopelessness and pessimism. The third one is feelings of guilt, worthlessness or helplessness, irritability, and restlessness. And they also can feel loss of interest in all activities or hobbies once pleasurable, including sex. Next. Okay. For the symptom, they also can feel fatigue and decreased energy, overeating or appetite loss. Then they will feel difficult concentrating, remember details, or in making decisions. They will feel so hard to remember and making any decision that they'll do in life. They will get they also get a possibility to have an insomnia, early morning wakefulness, or excessive sleeping. Next, they also got aches or pains, headaches, or digestive problems that do not ease even with treatment. And they will feel like they want to suicide attempts. Okay, next. Okay, so what is the causes of depression? Depression causes, we have so many of causes of depression. There are several possible causes of depression. They can range from biological to circumstantial. Common causes include, next. Okay, the first causes is family history. You are at a higher risk for developing depression if you have a family history of depression or another mood disorder. Then you have an early childhood trauma. Some events affect the way your body reacts to fear and stressful situations. The third one is brain structure. There's a greater risk for depression if the frontal lobe of your brain is less active. However, scientists don't know if this happens before or after the onset of depressive symptoms. Okay. The next causes is medical condition. Certain conditions may put you at higher risk, such as chronic illness, insomnia, chronic pain, or attention deficit hyperactivity disorder (ADHD), and it can cause from the drug use. If you a drug use, a history of drug or alcohol misuse can affect your risk. Okay, next. Okay, this is based on statistics. About 21% of people who have a substance use problem also experience depression. In addition to these causes, other risk factors for depression include low self-esteem or being self-critical, personal history or mental illness, certain medications, stressful events such as loss of a loved one, economic problem, or divorce. Next. Okay, so now we move to how to treat for this problem, how to treat depression. Treatment for depression. Living with depression can be so difficult, but treatment can help improve your quality of life. Talk to your healthcare provider about possible options. You may successfully manage symptoms with one form of treatment, or you may find that a combination of treatment works best. Next. It's common to combine medical treatments and lifestyle therapy, including the following. Okay, first one, I'll talk about medication. Your healthcare provider may prescribe antidepressants, anti-anxiety, and antipsychotic medication. Each type of medication that you use to treat depression has benefit and potential risks. So, the medication that you eat, you need to based on your psychology doctor first. Okay, first is psychotrophy. Speaking with a therapist can help you learn skills to cope with negative feelings. You may also benefit from family or group therapy sessions. Next. Okay, the third one is light therapy. Exposure to dose of white light can help regulate your mood and improve symptoms of depression. Light therapy is commonly used in seasonal affective disorder, which is now called major depressive disorder with seasonal pattern. The fourth one is alternative therapy. Ask your healthcare provider about acupuncture or medication. Some herbal supplements also can use to treat depression, like Sejong SME, and fish oil. Talk with your healthcare provider before. By the way, you need to talk with your healthcare provider before taking any supplement or combining a supplement with prescription medication, because some supplement can react with certain medications, and some supplement may also worsen depression or reduce the effectiveness of medication. Okay, the fifth one is exercise. Aim for 30 minutes of physical activity 3 to 5 days a week. Exercise can increase your body production of endorphins, which are hormones that improve your mood. Okay, number 6 is avoid alcohol and drugs. This is very important. Drinking or misusing drugs may make you feel better for a little bit, but in the long run, these substances can make depression and anxiety symptoms become worse. Okay, next. Okay, so number 7 is Learn how to say no. Feeling overwhelmed can worsen anxiety and depression symptoms. Setting boundaries in your professional and personal life can help you to feel better. So, if someone asks us to do so many things like it is not our word, so you have to learn to say no. You have to be brave to say no. And the last one is take care of yourself. You can also improve symptoms of depression by taking care of yourself. This includes getting plenty of sleep, eating a healthy diet, avoiding negative people, avoiding toxic people, and participating in enjoyable activities. Sometimes depression doesn't respond to medication. Your healthcare provider may recommend other treatment options if your symptoms don't improve. Next. Okay, we move to conclusions. So, for conclusion, to depression is all human beings have the right to a perfect life. If you're going through a critical moment, look for something that can calm you down. In addition, you can find someone you trust to express all your feelings, born in the here or mid therapy. There is hope even when your brain tells you there isn't. Okay, so I'll put this quote. Uh, you have to be at your strongest when you are feeling at your weakness. I hope all people out there that have depression can find for the therapist, for the psychotherapist doctor, and will feel better. Thank you. That's all from me. Thank you.